Hello, I'm Florence John Duo and welcome to Olsem Wanem. The first diagnosis of HIV was done in Papua New Guinea in 1987. That was 29 years ago. Since then, the number has increased dramatically. According to a World Health Organization report in 2005, HIV and AIDS has been the leading cause of death at the Port Moresby General Hospital. The question is, what is the current status of HIV and AIDS in the country? By 2008, PNG made up 99% of new cases in the Pacific, and that unprotected sex was the main mode of transmission of AIDS across countries in the Pacific. Since then, the HIV epidemic was contained in Papua New Guinea because of the dedicated effort and attention given in that area.
The general population prevalence on HIV is at 0.8% of the adult population. So that's just a little bit under 1% of the adult population. Now, that's a little bit down on earlier guesstimates. So about a decade ago, we thought that Papua New Guinea was heading towards a South African style epidemic that would have much higher prevalence rates. Unfortunately, we were wrong. And fortunately, some of the early prevention work in Papua New Guinea has helped to control the epidemic.
However, in recent years, HIV/AIDS awareness programs in the country have dropped, and recent data that was collected from antenatal clinics show that new infections have increased in 2015.
But I can report that last year, the new infections come up a bit. So that's another, that's a sign for us that we should not relax. Countries in Africa and other countries where the epidemic has been controlled, they've relaxed or not put in any resource investment into it, and then they see it coming up again. So we cannot really relax for HIV. So, in fact, the prevalence rate is now it's 0.8 now. Like it's rounded off, 0.78 or something, but it's 0.8 rounded off. So in numbers, we got about 2,700 new infections last year.
According to UNAIDS country director, there may be a number of factors contributing to the increased statistics.
There are probably quite a few factors. Some of it may just be statistical. We're doing a better job of getting more information from more places, so we're doing a better job of understanding what sort of an epidemic we have in Papua New Guinea. But also add to that, that we have a number of issues happening at the moment, as is in the press every day, happening with the delivery of health services. We have an ongoing financial difficulty situation growing in Papua New Guinea that's also having an impact. So there are a number of factors that may be playing into how easily people are accessing services in the health system.
Key populations in PNG, such as transgenders, sex workers, and men who have sex with men or MSM, have high prevalence, and they are encouraged to go for HIV testing to know their status.
The populations most at risk are the populations that are most sexually active. So we worry about young people, of course, as they debut their sex lives, but people who buy and sell sex, so female and male sex workers, men who have sex with men, transgender people. One of the very first directors of the Global Program on AIDS in the United Nations talked about HIV being an epidemic of the excluded, and I think he was right. We're looking at an epidemic that most affects the people who are on the edges of society. There have been a number of small research studies. There was a very good study done a few years ago by the Institute of Medical Research in partnership with some universities in Australia, a study called the Askim Nasave. They looked at transgender individuals, they looked at men who have sex with men, they looked at men and women who sell sex. Now I said that in the general population, the prevalence of HIV is just under 1%, at 0.8%. Now in the Askim Nasave study, they found that with men who have sex with other men, the prevalence rate is around 9%. With women who sell sex, it's around 19%. And with transgendered individuals, it's at 24%. That's unbelievably high. These are very, very high rates of HIV. And the reason that that is the case is the fear of getting tested, the lack of access to the services, the lack of access to prevention, to education programs, the feeling that if they go and tell someone in the health system that they've been selling sex or having sex with another man because of the legal implications in Papua New Guinea, that they could be subject to criminal charges, for example.
We already know that their prevalence is high in them from the information, little information we have. So by having a concentrated epidemic, that means that our response must be like different, like two different epidemic settings. Like in the general population, we might do awareness and other things, but in these populations, we need to do more.
You're watching Olsem Wanem. Access to health services is a human right that each and every individual has, regardless of race, gender, and ethnicity. In our previous segment, we heard about the key populations whose HIV prevalence is high and are most at risk. This includes sex workers, men who have sex with men or MSM, and transgender people. A transgender person is someone who is male or female but sees him or herself as an opposite gender. These most at-risk populations most often are discriminated and stigmatized upon when seeking health services. This has resulted in many of them dying from HIV and AIDS, which could have been prevented if they had received medical help in terms of the antiretroviral treatment, or ART, which many people living with HIV/AIDS are taking and are living longer.
It's absolutely critically important. You know, in most countries, but especially here in Papua New Guinea, really, from my perspective, we have an epidemic that's driven by stigma and discrimination. We have an epidemic that's driven by fear on the part of the people who most need to access the services and who feel discriminated against when they go to access those services. We hear examples from all over the country where people are treated rudely, they're refused services, they're lectured, they're given references to, you know, church groups rather than effective treatment, and people not recognizing the realities of people's lives.
This weekend, in a week, we see around 2 or otherwise 1, but within a month I see around 4 or 3. That's all. I don't see plenty more than exceeding 5 now. They're very sensitive people. They don't want to talk to anybody. They don't want to, act suspicious and all this stuff. So when they come in, they see that there are lots of patients around. They feel a little bit, they don't feel good to enter.
The Olsem Wanem team spoke to some of the transgender people, and they expressed that most times they do not feel free to seek medical services because of the atmosphere that surrounds them, such as sitting in the outpatient area of the hospital and being stared at by other people because of who they are.
I guess the clinicians should accept different type of people that access the clinics, especially men with diverse sexuality, and especially the transgender people, or even the general population. But looking more into the transgenders and the MDS people, they need to really accept them in their clinics, because these are human beings that you are dealing with, and the clinicians will have to know that they are there to really see if their health is okay. Their health and well-being is very, very important, and that's the first priority thing that they will have to know in their life.
But they further expressed that in recent years, many medical workers have been sensitized, and the clinics they are attending now are conducive for them.
Back then, when the atmosphere was not conducive, but at that stage now, due to lots of NGOs coming up, they've been doing advocacy work in terms of sensitization of clinicians and health workers. So by now, there's some room there. You feel that when you access the treat for health checks or whatever, it's more conducive nowadays. But that's in one particular area, like in the cities.
I've been actually accessing Pro Support Clinic. It's the SRH clinic. And the services there are very convenient for me, and it's very conducive as well. The clinicians there are very, very friendly. When going to access the clinic there, I've been very, very open to myself about my status as being a trans person, and yeah, I should say they are so friendly. Yeah.
The clinic manager for Lost Road Clinic said they categorize the transgender people and men who have sex with men as patients.
We see them as a patient. We don't discriminate, we don't say that, or we don't through our body language. Sometimes they see our body languages. So what we do is we calm them through speeches that we give them. We actually put them into our shoes. Like, if I were them, then how would I feel? And so we actually encourage them that accept just as you are. And we provide services that it will actually help you. It's not to discriminate you, it's not to harm you, but we are trying to help you find a proper way so that you will live a better life.
The transgender people are encouraged to attend clinics for their own good and to know their HIV status and live a quality life.
I think my advice would be like, your life is important, and some of these things are human being things and emotion or whatever, but your life is important. If people chase you away, or if you have to report it. If it's the hospital, you report it to us, or you report it to the hospital management.
I would like to encourage more trainees or more transgender people in the countries that we are all human beings, and if we sit back and look, nobody's going to help us. If you want to access health services in terms of what services you want, go and get it.
For those MDS and transgender individuals who are living here in PNG, my advice to you is that it's better you go to a nearest SRH clinic to be tested. There's always treatments available for you to be well.
Welcome back to the program. There have been numerous campaigns by responsible authorities targeting HIV and AIDS and how vital it is to be tested and get treated. An organization called Couple Champions has also been advocating on HIV and AIDS. In 2013, as part of the response to HIV and AIDS, an organization called the Couple Champions was launched. This was the first national organization for MSM and transgender people in PNG. Since they are part of the most at-risk population of contracting HIV and AIDS, a campaign called the Test and Treat campaign was launched. It is aimed at encouraging and motivating transgender people and MSM to access HIV and STI treatment and care services.
The Test and Treat campaign that we have done last year was launched in World AIDS Day, and it was a very good it was a very good campaign that we have done for men with diverse sexuality and transgenders in Papua New Guinea. And this Test and Treat is to reach out to men with diverse sexuality and transgenders in PNG to access health services, to come for blood tests and know the HIV status. And it's important because if they're having anal sex or oral sex within a same-sex practice, it's a must that they must know the HIV status and check for STIs as well.
Papua New Guinea is among 35 other countries in the world that criminalizes same-gender sexual relations. This is one factor that instills fear in transgender people and MSM, apart from the stigma, discrimination, verbal and physical abuse they face in their daily lives.
There are a few reasons why we did this, because in Papua New Guinea, in PNG, there is a law that says that it's illegal between same-sex practice. So, and we know that there are men with diverse sexuality who are hiding out there, who are very, very silent about their identity and the practice behavior. And we want to reach out to these people to make sure that they must access health services. And the health services must have a conducive environment for those who want to access services, not HIV testing, both transgenders and MDS MSMs.
The transgender people who were brave enough to talk to the Olsem Wanem team had the opportunity to air their views on the Test and Treat campaign.
This is one of the campaigns that will, give the message, deliver the message how to most of our community members, especially the trans people and the men with diverse sexualities, where it is more good that they have to be, go on and get tested for HIV and to plan their future early while, some of the benefits like, going on to ART, so that they can avoid some of the things like death.
The Test and Treat campaign that is done by Couples Champion is very, very important for the trans people here in PNG, because a lot of us are being very vulnerable to any sickness, I should say, or infections.
The director for the National AIDS Council Secretariat also echoed the importance of this campaign.
Less than half of the general population, including these people, they don't know their HIV status, and then these people, because they practice risky behavior, we know that the chances of them getting HIV is high. So that's why they should be tested, and that's the only way, because they are high at risk. They have many partners, and it's not only like you test once, but depends on your behavior. You should be testing regularly, at least twice a year, 3 times a year. It's not that you just test once and that's it. If you're going to continue practicing the same. If they're on treatment, it also, their chance of transmitting is low, with a low viral load. So there's also prevention. So the idea is really about prevention. And then once if they're tested, and if they're positive, then we want them to get treatment, and they should have access to treatment. And this is where when they even for testing, when they want to go and get tested, they are discriminated or things like that. So that's the area that we from us, we work with them, but we had healthcare providers and other people out there to to understand these people and treat them.
Welcome back. Since 1987, all children born in PNG will never know what it's like to live in a world that is HIV/AIDS free. Efforts by organizations to minimize the epidemic situation are vast and are ongoing. One such organization is the United Nations Joint Program on HIV and AIDS, better known as UNAIDS. They have a strategy called 90-90-90. The UNAIDS 2016 to 2021 strategy is a bold call to action and, most importantly, fast-track and reach the people who are said to be left behind.
We are working on a program that we call 90-90-90. So the idea is that we want to see 90% of the adult population tested for HIV, 90% of people knowing their HIV status, and 90% of people who are living with HIV on treatment and with their virus suppressed to the point that it's difficult for them to pass the virus along. So for us that means working in the communities that and with the groups of people that I talked about earlier, so female and male sex workers, people who buy and sell sex, men who have sex with men, transgendered people, and then in the parts of the community with the higher rates.
Every human being is born as a person equal in dignity and rights regardless of their religion, race, culture, or even sexual orientation. They do not deserve to be denied access to basic human rights services such as health services. As citizens of Papua New Guinea, and to be denied access to certain services is a human right violation.
As a Papua New Guinean citizen of this country, I would like people to really get to understand who trans people are, and because we are human beings as well. We don't want to be treated, in a very bad manner. We want to be accepted in the communities at where we live and wherever we go, whatever that we do in our social lives. We'd like to, like people to really get to understand us and to gain that respect towards us.
People travel internationally and they're coming back with some, knowledge about that. But to implement that, I think we need more support from the government and from other policymakers and, even the hospital themselves, to ensure that the environment there is conducive for all trans people to access it. So trans people should not be categorized as outcast or anything. They need to be seen as any ordinary citizen that access health services.
To eradicate such marginalization on certain citizens of this country, there is still much work to be done to sensitize people and even changing some of the things that Papua New Guinea has been complacent with for many years.
There are several things we need to do, and I mentioned the legal situation. We do need to change the laws in Papua New Guinea. We need to decriminalize sex work, and I don't mean legalize, I just mean take away the punitive laws that allow the police, for example, to threaten and abuse and blackmail people that sell sex, or the laws that make people feel that they're criminals and so they choose not to access services. We need to deal with those so that the playing field is level for everyone, no matter who or what they are. Then we need to educate our health care providers. We need people understanding that, as you said, we're all human beings, we're all the same. Whatever our identity, whatever clothes we choose to wear, whatever we identify as, be it male, female, or something else, we're equal, and we're equal under the Constitution, we're equal under the law, we're equal under God's protection.
As a government body, I think we should work more with them and talk about things like the law and like what we've been talking, the issue about accessing or denied treatment and like being chased away, or even access to treatment is one, and then the police with the law as well. Those are two things that it's been going on, and that's we've tried to raise it that various forums. But there's things that, it takes a while. And like I said, changing the law, it can be very long. And that's why, like, we just need to, work with other civil societies, and, we just need to come out more.
That's all we have time for in this week's edition of Olsem Wanem. If you have any comments or stories you would like to share, please send us an email via the address on your screen or leave us a message on our Olsem Wanem Facebook page. Until next week, I'm Florence John Duo, and on behalf of the Olsem Wanem team, thank you for watching and have a pleasant evening.